All right, welcome everyone. We're going to get started here. So my name is Nick Zupan. I'm the epidemiologist with the Rock County Public Health Department. So thanks for joining for another live stream of Numbers with Nick. Today we're going to go through some of the basic information about the new cases and that kind of thing. And then we're going to get into the reopening metrics that we use that help guide some of the decision-making process as we move to the next phase of reopening. So if you haven't heard, we announced on Wednesday that the Rock County Public Health Department has relaxed some of its public health recommendations for the community based on the numbers and the trends that we're seeing, and also the information that we heard from our partners. And so we are now in phase 2 of the Rock County reopening plan. We were in phase 1 for quite a long time based on the COVID spread and the number of hospitalized patients and the people who are dying from COVID. At this point, the case activity is pretty low and the numbers are looking good in the hospital. So we were able to move ahead with relaxing again some of those public health recommendations and increasing some capacity recommendations out there in the community to make sure we're moving forward cautiously so that we can begin to resume life as normal, but also still keep the virus in check and prevent unnecessary cases of the disease. So with that, I have the daily update pulled up here on your screen. So just wanted to run through those numbers real quick before we get into kind of the main content for today. But right now we're looking at about 170 active cases in Rock County, and this is based on the information that we have at hand about who's had the disease and who has gotten over their symptoms. I should remind you that I should note that this information is from yesterday afternoon. These are the official counts, and we have to date had 14,445 residents in Rock County test positive for COVID-19. There have been 159 deaths, and a little over 73,000 of our residents have tested negative for the disease. In terms of our daily increases, this 14 number is pretty consistent. With the past week or so, we're averaging about 14 new cases per day. So we're not quite to the level that we had seen in kind of the midsummer when COVID spread was at its lowest point throughout this pandemic, but we are certainly trending in the right direction. So with that, I'm going to switch gears and I'm going to pull up our Rock County Public Health website. So again, you can get to this information if you go to co.rock.wi.us/public health. And if you click on the coronavirus disease 2019 image, that's kind of front and center when you land on that public health website, you'll get to the COVID-19 information, all the information that you would need in terms of data, some information about the vaccine, and a variety of other types of information. Right now we're in the data section, and kind of that's my area. So I pulled up that website and just want to scroll down here, and we're going to take a look at the Rock County reopening dashboard. So as I click that, the report will be opening here. And we're just going to talk through some of the metrics that we use in determining when it's safe to move ahead to the next phase of reopening. So the very top, there is a little bit of explanation of how to interpret this dashboard. Basically, what we've done is we've set it up in a kind of stoplight format where we have a green, yellow, and red system for kind of categorizing how we're doing with our metrics. So green obviously means good, yellow is kind of caution, and red means stop. Basically, these kind of correspond to if things are looking good or if things are not looking so good, and we should be concerned about COVID spread in the community. We also have linked here in the top section the Rock County reopening phased plan. So I'm not going to click that for today's stream, but if you're interested in seeing the details related to the reopening plan and what some of our public health recommendations are, you can click that link and that will take you to that document. But currently, as I said, we're in phase 2. So we've just recently moved from phase 1 to phase 2 as things are looking pretty good related to COVID spread. So at the top of the document, we have the metrics that we are using, why these metrics are important, and what our threshold levels are from going from green to yellow to red. And then the final column shows the current status that we're at in Rock County based on the last period that we've examined the data. So I'm not going to go through this word for word, but just wanted to let you know how this document works. I'm going to scroll down to where we start getting into the data. And so I want to just go through some of these metrics and talk through the importance of these metrics and help you understand why we use these metrics in our reopening decision-making process. So the first metric that we use, and you probably have heard this somewhere along the line, is percent positivity. Basically, what we're looking at is we want to know how much testing is going on in Rock County and what percent of those tests are coming back positive. If a high percentage of tests are coming back positive out of all the people who are being tested, that indicates that there's probably high spread of the disease going on. If the percent positivity is low, that means that based on all the people who are testing, there's very few cases that are being identified, which is a good sign. That means that our surveillance is working and we're able to identify lots of the cases that are out there while there aren't as many cases relative to the number of people who are testing negative. So I know that's a little bit of a mouthful. This measure takes into account both the number of people who test positive and the total number of tests that are being done in this time period. So in the past, we had used unduplicated test results. So what this means is if someone tests positive or negative more than once, they're only counted one time in the percent positivity. We have shifted in late January, we changed and we got some more information actually, and this is part of the reason that we switched gears, but with more data that was becoming available to us, we were able to understand in more real time how many total tests were being done in the county and how many of those were coming back positive. So at this point, we're taking a look at all of the testing that's been done, even if people are testing multiple times in a 2-week period or in a period of time, we're capturing all of that information in our computation of the percent positivity. So the goal here is we want to see less than 5% of the total tests over a 2-week period. We want to see less than 5% of those tests coming back positive. In the most recent 2-week period, you can see we have had 2.4% positivity. So 209 tests came back positive out of a total of 8,877 total tests that were conducted in Rock County. And so that gives us our 2.4% positivity rate. So this is really low, and this is a good sign. This graph in the middle of the page shows the percent positivity over the course of the pandemic beginning in June when this measure was first being collected. So the important part is that we're seeing a steady trend downwards in the right direction. In mid-November and late October, we were seeing some of our highest percent positivities that we had seen throughout the course of the pandemic. And since that time, we have had some ups and downs, but by and large, we're trending in the right direction. And now we're seeing a very low percent positivity, which means that there aren't as many people testing positive, and there are still a large number of people who are being tested for the disease. We are seeing some of our numbers drop in terms of the total number of tests. So we do encourage that if you still want to get a COVID test, you can get tested. Tests are available across the community, and we just encourage that if you do have symptoms, you think you might be exposed to the illness, to go ahead and get tested. This will give us a good sense of where we're at in terms of COVID spread. A lot of people don't have really severe symptoms. It can be a very serious illness for certain people. And so we want to make sure that we're still aware of where those diseases are occurring in our community. The next page is not one that we're currently using in our red, yellow, green stoplight kind of metric categorization system. But basically, we also do look at the number of people who are testing positive based on the number of people who have tested over a 14-day period. This helps us kind of get a sense of where the new cases are occurring based on people who haven't tested prior. So this is the measure that does not include those duplicate test results. So if a person tests positive more than once, they're only counted one time. And similarly, if a person tests negative more than once, they're only counted one time in that denominator. So it does not account for a large number of negative tests. You can remember that there were over 8,000 total negative results that we got in that 2-week period, or 8,000 total tests that were done in that period. And with this percent positivity, removing the duplicates, we're not taking into account about 6,000 total tests that were done in that time period. So it's a little bit skewed at this point because so many people have been tested and testing is widely available in the community. But it is a measure we want to be aware of in terms of the new cases and how that informs kind of the COVID activity over the course of the time span. So again, this metric is very similar where we've seen a pretty steady downward trend since kind of mid to early January, I guess. Looking at these numbers, we started to see a pretty nice decline as the COVID spread has slowed down quite a bit. The next metric that we use, and I mentioned this already, is the total testing that is being done in the county. So we have a goal of 240 or more tests per day over a 14-day period. In the last 14 days, we've had 634 tests being done per day. 8,877 total tests were administered. This is slightly lower than a few prior weeks, but it's still very, very far exceeding our goal of 240 per day. Again, if you feel like you need to be tested, there are still testing resources in the community available and very easy to access at this point. The next metric that we use in the reopening kind of decision-making process is the number of positive cases that are among healthcare workers. The reason that we selected this measure is that healthcare workers are an essential part of the workforce, and we want to make sure that there are adequate numbers of healthcare workers to potentially tend for sick or ill patients, whether they have COVID or another disease or some kind of acute issue. So our goal is to have no more than 5 healthcare workers testing positive over the last 2 weeks. In this last 2-week period, we had 3 new cases among healthcare workers, and so this meets our goal. And we have seen our numbers fall substantially since the healthcare workers were able to be vaccinated. So since that time, kind of that mid-December period, we have not seen a lot of cases among our healthcare workers, which is great news. I think it's showing that those who have been vaccinated are well protected from the illness, and there isn't a lot of spread among that essential part of our workforce. Another metric that we use is related to our healthcare resources. We want to make sure that we have plenty of beds available and that we're not seeing any kind of surge or kind of our hospitals being at maximum capacity. We want to make sure that there is space if there are people who need treatment because they have COVID or they need treatment for another health issue that they're experiencing. So one of the measures that we're using is keeping tabs on our hospital systems and making sure that they're not indicating that they're at maximum capacity. I can report, thankfully, that our health systems have begun to indicate to us that they're not at that max capacity for their ICU or their general medical surgical beds. This is great news. We've been kind of operating for a few months now in a situation where there aren't a lot of hospital beds available. And this is concerning for anyone who has a health issue and may need to be hospitalized. We're seeing kind of very limited resources available for a few months there. And, if someone needs to be hospitalized for COVID or for another reason, we want to make sure that those resources are available for those individuals. So our ICU beds and our ventilators are exceeding their kind of goal percentages of being available. This is the graph in the middle of the page here. All signs are pointing to improvements in kind of the strain on our hospital systems right now. And I think that's great news moving forward. Again, we've started to see a real improvement since the vaccine has started to be rolled out, where as people are being vaccinated, we're seeing less spread of the disease. And also an important part about the vaccine is it's very effective at preventing severe illness and the need for hospitalization. So when we have a large portion of our 65 and older population who have been vaccinated, either with their first or the complete series of the second dose, we're seeing a lot of people have that protection and very few people needing to be hospitalized or have severe illness, which is great news, and also just a testament to the importance of the vaccine and how effective it has been so far. Um, we really have seen a noticeable impact based on the trends and the metrics that we're tracking. A few other hospital metrics that we're tracking is we want to make sure that they have adequate staffing. So right now we have a few of our hospitals still reporting that they have some critical staffing shortages. Not all of our hospitals are reporting this, but we do collect this information regularly to make sure that they're comfortable with a move to the next phase. Based on the conversations that we did have with our healthcare providers and our medical system leadership, they were comfortable with the Rock County Public Health Department moving to the phase 2 of the reopening plan based on the staffing levels that they were seeing and some of the improvements in the trends in terms of hospitalized patients. Although they still are seeing some shortages in certain areas of their hospital regarding their staffing levels, they were comfortable with our move to the next phase of reopening. The other metric that we do want to be aware of is just making sure that the hospitals have critical supplies. So these are like masks, gowns, gloves, those kinds of things that help hospital workers remain protected while they're working from any transmission of the illness. It's really important that they have these resources available so that these healthcare workers are not at an elevated risk of getting sick from treating patients who are sick with COVID. Thankfully, we've not seen kind of an issue with our supplies in terms of masks and gowns and those types of things for treating the patients that are in the hospitals. The next metric relates to the Rock County Public Health Department contact tracing efforts. Basically, what happens when someone tests positive for COVID-19 is the health department is alerted that this person has tested positive. We make contact with that individual and we try to gather as much information from them as we can in terms of who they've been in contact with, how many people they've interacted with, and how many of those individuals may be considered a close contact. So a close contact is someone who was within 6 feet of a positive case for 15 minutes or more. And so we use the information that people provide us to come up with a list of potentially close contacts who are exposed to the illness. And the idea behind this process and this practice is to make sure that anyone who potentially was exposed to the virus has the information that they need to protect themselves and prevent further spread of the illness. So what we want to do is we want to make sure that we're contacting these individuals as quickly as possible. And our goal right now is reaching 75% or more of the close contacts within a 48-hour time window so that we're adequately surveilling the disease. So right now, we're contacting these close contacts. 87% of them are reached within 48 hours, which is a very large portion of the close contacts are being reached very quickly within that 48-hour window. We do have some additional information about our people who are testing positive and our confirmed cases and how quickly the health department is able to contact those individuals. Right now, these metrics don't factor into the reopening decision-making process, but they are important contextual pieces of information that we do take a look at and monitor on a weekly basis. So if you mouse over, 72% of our confirmed cases were reached within 48 hours, and 72% had a completed interview. So that means we went through an entire questionnaire with those confirmed cases and gathered as much information as possible with anyone who tested positive. The final metric that we're using in the reopening dashboard and decision-making process is the number of people who are seeking care for COVID-like symptoms. So these aren't necessarily people who have tested positive for the disease, but people who are presenting to their healthcare systems with symptoms like coughs, respiratory issues, any kinds of symptoms that would be consistent with a COVID-19 illness. The reason that we track this information is sometimes people aren't tested, whether they choose not to be tested or they want to wait or something like that. And so in some cases, we may see symptoms that are consistent, and that will be kind of the early warning sign of a potential uptick. So thankfully, we have seen very similar trends in these numbers that we have seen in our positive case rates, where we're seeing a steady decline since about mid-November in the number of people who are presenting to their healthcare providers with COVID-like symptoms. So these are the pieces of information that we're using as we move in our phase 2 recommendations of our reopening plan. There are a couple measures that are no longer being reported on. So testing availability for healthcare staff specifically, and damaged facilities are no longer being reported. These are less important as we have moved through the pandemic, where we're finding that our healthcare systems and our hospitals are not so taxed that they're being damaged and patients are being cared for in hallways or things like that. And the other metric is related to testing. We have large numbers of tests available in our community, and anyone who wants to be tested can be tested at this point. So those are the metrics that we're using. I'm just going to scroll up quickly to the top, and just wanted to let you all know that we're also making sure that in addition to the data trends and those kinds of things, the metrics are all showing positive movement and showing optimism for reduction in COVID spread in our community. We also make sure that we're connecting with our partners in the community to make sure that they would be comfortable with a move to the next phase of reopening. So this includes leadership in our healthcare systems, our school administrators, our public, and our community, other community partners that we work with on a regular basis. We want to make sure that everyone's kind of on the same page before we make a big decision like this in terms of moving to the next phase of reopening. So as I said, you can always access the plan from our website. You can also access the reopening plan from the link at the bottom of this text here. At this point, I'm just gonna pause and see if we have any questions that I can answer. We'll check the chat box here and see if anyone has had questions. And it doesn't look like we have any questions. So I will close out here. I want to thank you all for joining us today. And we may be moving to an every other week kind of schedule. We'll kind of see where we are doing a weekly press briefing that is streamed live to our Facebook page as well, with a lot of the same types of information that we're providing on these segments. But we'll keep you posted. If you have any questions, you can always reach out to us via social media, and we'll try to get back to people as quickly as possible. Until we meet again, stay safe and healthy, everyone. Thank you.